But anyway, welcome everyone to this webinar with Graeme Jones on organics testing. I'm Anne-Catherine, co-founder of Nordic Laboratories and DNA Life, where we have focused on functional medicine. And remember, organics test and the supplements that Graeme will be talking about, you can get it in your practitioner profile on Nordic VMS or DNA Life VMS, whichever is your go-to profile. And then I feel I want to announce that what Nordic VMS looks like today, it will look different soon. It will be better. It will have different functions, and so we have some programmers designing these days. And today I gave them feedback on some of the colors and so on. So hopefully you will very soon have a tool that is better than what it is now. So it's not going to change that much, but it's just the functionality and creating patients and searching for products and so on, hopefully should be easier. But I hope not more than 1 month, and then we will launch it. And that, of course, I have to ask for you to be a little bit patient in the beginning when something changes, but it really should be a lot more like self-explanatory and really very close to where we are at now. But you know, all things like news, and it just needs a little bit of a new habit. So I'm very pleased to tell you that that's in the pipeline for sure. So the next webinar that we have planned right now is also Graeme on GI 360 and GI effects. So some of the other stool tests that we have. We may in between then have a webinar on, I'm planning that now, on some probiotics. But of course we will invite you all as soon as we know more. So you're eager to learn about organics test, and Graeme is eager to get going. So I will pass you on to Graeme. And remember, before I hang up, that we are recording and we will share the recording with you as soon as we can, and also the slides. And also we have this organics patient handout that we will make sure is in the mail after or with the recording and so on as well. So you can use that and send that out and share that with your own patients. So enough from me. Graeme, your go.
Thanks, Anne-Catherine. Yeah, so today, of course, everyone, we're going to be talking all things organic acid related. I'm just going to start sharing my screen here, and then we can get going. And Catherine, does that work? Can you give me the thumbs up? Yeah, okay, great. So okay, yes, my name's Graeme, and if you've not met me before, I'm the clinical director of Nordic Clinic Stockholm, and today it was snowing, so that's very disappointing after a few days of nice weather. But yeah, of course, today we're going to go through one of perhaps one of the tests that I've been using in clinical practice for perhaps the longest period of time, very close with stool analysis. But organic acids, I can remember, you know, starting with this like 12, 13 years ago, just quite soon after I got into medical screening. So we'll let's get started in this, and as per usual, we've got some just key session points where the oat and the organics are helpful clinically, because we have two tests in the system with different spelling, so you need to be aware of that one. What can be learned from the test, basic result interpretation, and then some treatment strategy options with case study examples. Of course, we don't have all the time in the world, unfortunately, so I can't go through everything, but we'll cover some key elements in the training today. So of course, I mean, with organics, we're really looking at metabolomics. So very simply, the study of products of metabolism. So of course, this is a nice kind of flow diagram overview. We have the genome, the transcriptome, the proteome, and then the metabolome. And of course, this is predominantly what we're measuring here in an organic acids test, these metabolites out the bottom end here. So basically by looking at these metabolites or measuring these metabolite levels, it gives us a window of insight into what's actually happening in different systems of the body. So of course, perhaps the main interest or focus and use of organic acids testing is really to get a mirror of the metabolism of the cell and the mitochondrium especially. So of course, a lot of us clinically will be using organic acids testing to identify how or what's going on with the mitochondria. But organic acids, they're found in blood, but of course excreted by our urine or by our kidneys into our urine, where we find them in much higher concentrations, and it can be useful in many different conditions. I think that's a really good value in the organic acids test. But some things here, chronic fatigue, cognitive symptoms, autism, autoimmune disease, or where perhaps it's used especially by practitioners. So to expand a bit more on this, when should you consider an organic acids test, whether it's the oat or it's the organics? Well, I think it's a general overview of functional nutritional status. So it may be that, of course, patients can have standard blood tests for things like folate, but again, they might be normal on a folate blood test, or perhaps in the lower end of the range. But then in the organic acids test, we can see that the metabolite marker for folate is high, meaning that there is some kind of folate insufficiency. So I think the organic acids test is quite a nice test because it's giving you perhaps with some nutrients. Of course, it doesn't measure all nutrients, far from it, but it gives you a window, especially into B vitamins and amino acids and some others as well, is that do the cells have the right level of nutrients they need to function? I think that's one of the key benefits of the organic acids test. It's a nutritional analysis. Do these different systems have the nutrition they require to function as they should do? So also a nice thing with the test is that it gives you perhaps an overview of multiple system functioning at once. So of course, when you run a stool test, you're only getting an indication of the microbiome, for example, and of course some digestive and absorption markers. But the organic acids test is really nice because it covers multiple areas from nutrient levels, oxidative stress, methylation, dysbiosis. It can cover many things at once. So certainly when we have complex patients that maybe have had quite a lot of testing already, and we're not sure perhaps where do we go with this? What's the best test to start with? Organic acid would be one of those tests on the table that we might go with when looking for functional problems, just because it measures multiple systems. So can it help direct us into the relevant area that may give us a better understanding of why X patient has Y symptoms? So of course, mitochondrial function is a big plus with this test. If the mitochondrial metabolites are abnormal, then it's telling us something's not right there. And of course, this area of the body, the mitochondria, is gaining more and more interest. Of course, over the years, as we understand more and more about how they work and how they're important for even things like immune function. So that's really nice with this test because we get a view of that. Gives us an indication of stress, methylation sufficiency, toxin exposure, oxidative damage. again, functional bowel disorders. So if the client or the patient does not have the funds maybe to run multiple tests, and you want to get an indication of is there some kind of dysbiosis going on, again, this is a great test because it covers all that, or gives you an indication of that area and more. So I think clinically, we use this test a lot with energy issues, of course, fatigue, and that's very common in all patients, most patients that we see at the clinic. Migraine, of course, longevity. We know that both nutrients and the mitochondria are very important from a longevity perspective. And then it's certainly not a key area of my work, but I know, for example, of course, Anne-Catherine, and I feel a bit of an imposter here in one way, because she's done probably a lot more organic acid testing than myself over the years. So I'm going to be possibly pulling on her knowledge throughout the rest of the session, but certainly autism, neurodevelopmental disorders with children. And of course, organic acids, they are actually used in standard healthcare. So but of course, not as many as that's in an organic acids test that we offer, but there are metabolomics that are used in the standard system to look at inborn errors of metabolism in children. So it's not an unusual test necessarily to talk with our more allopathic counterparts, but it's usually more a specialist area of pediatrics. So how does it work? Well, the main thing with this test is or one of the main way it works, and what we're looking at, is that if you have the start of this process. So if we look at A here on the screen, A, in the kind of that pathway and how different substances are turned from one into another. So if we're trying to turn A into B, then that pathway will often require an enzyme, and that enzyme may be powered by a certain nutrient. So predominantly what we're looking at in the urine is, okay, if we know for the mitochondria that A must turn into D, then by measuring the metabolites in the urine, because we know that different metabolites are produced in different stages of these reactions, then we can see if there's more, for example, enzyme A in the urine than B, we know that there's a cofactor lacking. And of course, big one in the organic acids test are B vitamins and also magnesium as well. So this is how this test works. It really is saying, well, we should find, for example, in this case, we should find lots of D in the urine, or D at these levels. But if we can't find that, but lots of A, then there's the knowledge there that the first part of that process has broken down. It's not moved on. So nutrients and cofactors are needed in all steps of energy production. This is a really nice diagram of those who you studied your Krebs cycle will probably both love and hate this diagram, because we study it so much when you're doing your biochemistry. And of course, it just tracks fats, carbohydrates, and proteins through that cycle to basically the bottom, pumping out ATP for our cells to have energy. And we can see here that in lots of these different processes, carnitine, B vitamins, we've got magnesium, and also things like heavy metals and chemicals which can interfere with the citric acid cycle. So this is where this test is really nice, because it looks at various stages of the Krebs cycle and gives us an indication, is it working efficiently? I think the main problems with pathways, I guess, fall into four different categories, or I would define them here. but there can be nutrient deficiency. So it can be, for example, we can see amino acid deficiency in the test. Could be a cofactor deficiency, so that could be magnesium or another B vitamin. There could be genetic impairment of a pathway, which we, of course, we can't do anything to necessarily to solve that. You know, you've got the hand that you've been dealt with, and we need to try and work around it as best we can. Or there can also be a highly burdened pathway. So these are kind of the general things we'll see in the test. And then both of our tests, they look at these different areas. So we've got 9 areas which are very much the same. So mitochondria, carbohydrate, the glycolytic cycle, bacterial and fungal dysbiosis, neurotransmitters, but there are, etc. But there are some differences from the different tests. So I'm just going to go through those. If you're going to choose the oat test, which is through Great Plains, then it has the most extensive list of microbial markers, both bacterial and fungal species. It's the only test that has a marker for mold, but it has fewer vitamin markers than the Organix. Now, the oat test, it's the only one with oxalate markers. So depending on if you want to measure oxalates, then you would need to go for the Great Plains over the Organix from Genova. And it doesn't include the 8-hydroxy-2-deoxyguanosine, a marker of oxidative stress and DNA damage. But the amino acid markers are more expensive, and it does include several for inborn errors of metabolism. So that if you count the markers, there's 77, and of course it's urine based. Now the Organix from Genova, it's the only test of the 3. So when I'm talking about the 3, I'm also including the Nutraval in that statement. But it's the only test which includes 3 markers relative to glutathione status and limiters. So it also includes the 8-hydroxy-2-deoxyguanosine, and you get this p-hydroxyphenol-lactate. So a little better in the oxidative stress arena, 46 markers. And there is an extensive interpretation guide, well, for both tests. Now, from my clinical experience, I've done way more testing with the Genova Organix test than the oat test from Great Plains. There's probably, I mean, it's just probably more stems on the back that's what I learned to use, and that's the test that I stuck with over the years. And certainly from a Nordic laboratories perspective, I mean, and Catherine can probably tell you more about the history, but as I understand it, since I came into the Nordic labs team, that again, out of the organic acid tests, we've had much more experience and, if you like, a longer time in using the Organix test than the Great Plains oat test. I don't know if do you want to say anything about that, and Catherine?
Well, it is a little bit as history, because when I think Organix test was like the 3rd test that we got into after we had food intolerance test was the first one, then stool test, and then came Organix in, and it was the Organix from Metametrics back then. It was, so it's kind of stayed, but then as other labs develop other tests and there is these differences in the test, then you may choose to go with one of the others. But it's for sure Organix. Is the test that we have had for the longest time and most experience with, but that for sure doesn't say that the others are not as good or less superior or anything. It just really goes with what you're looking for. So yeah.
Thanks. Yeah, so I've definitely I'm more comfortable with talking about the organics test just because I've done many more of those tests. But of course, I still use the oat, the Great Plains test as well. So like Anne-Catherine said, it's not that necessarily one is better than the other. There's pros and cons to each. But on a general level, I think if you look at the marker breakdown, if you want more focus on vitamin markers, oxidative stress, and glutathione function, then my opinion is that probably the organics test is the better one to go for. If you want to cover like multiple things, including suspicion of mold, if you're really focused on oxalates or you want to know that, if you want to look for inborn errors of metabolism and GI imbalances, then probably the oat is maybe a better choice. But they're virtually identical in so many ways, it's hard to go very wrong whether you pick the organics or the oat test. So either's a good choice, and I'm going to show you again some results very soon where we have virtually identical results for the same patient using the two different labs. So I'm going to mainly focus on the organics, but we do have some oat tests in here as well. Now, if you go into VMS, there is an interpretation guide, and Catherine's going to link to that when we send out the follow-up material anyway. But as you can see on the left-hand side here, this is the organics with an X, so it's the Genova test. And it's broken down into different sections. So you can see the section on the left-hand side, fatty acid metabolism, then we've got carbohydrate metabolism and energy production here on the first page. And you have your quintile distribution. So as you can see here, we've got first, second, third, fourth, and fifth quintiles. And some of these quintiles, for example, if you go down to lactate number 5, you can see that it's got both red in the first quintile and red in the fifth quintile. So you do have to be aware at which marker you're looking at, because of course some it's okay to be down in the first quintile, but some markers it's not. So the first thing you do is look at where these like black diamonds or squares, whatever you want to call them, are situated. And of course, we're going to focus, first of all, on anything with a red H or a blue L for high or low, because then that's really telling you that it's outside of the normal ranges. And that's where your first focus is going to be. And then, of course, you can look at this in more detail. So if you've got a level in the top of the fourth quintile, you know that it's approaching more of an abnormal status. So what I generally do when I'm looking at the organics reports, I'm going to pretty much look at the whole report first and see what's going on in general. I'm going to focus on high and low results as priority, and I'm going to consider red flags. Although I think in the organic acids test compared to a stool test, I mean, they're a little bit harder to define what are possible red flags here. I mean, I've written them in the bottom, in my opinion, that red flag markers are when you've got high levels of lactate, beta hydroxybutyrate, quinolinate, p-hydroxyphenolactate, and 8-hydroxy-2-deoxyguanosine. I wish they would make these a bit easier to say. So I think if you've got a client, so of course this is mostly more at risk of us on the call that are not medical doctors, but I think some of these conditions, for example, high beta hydroxybutyrate could be underlying diabetes. The things like 8-hydroxy-2-deoxyguanosine, if it's very elevated, could be things like underlying cancer. I mean, again, the chances are that is present is probably quite slim, but of course, you never can be too careful. So if you find high levels of these markers and there's not an explanation, if that client hasn't had extensive medical evaluation or review, then certainly you might want to, I mean, as I would normally do, is advise them to always speak to their doctor about their health, especially in reference to markers on the test here. Now, of course, we all know probably the doctor's not going to understand this test and probably had no training in it, but at least if you find like a very high beta hydroxybutyrate and you're referring them for, let's say, for diabetic review and they're overweight and got metabolic syndrome, then of course they may end up with a diagnosis and some kind of medical management, and of course then you can still help them metabolically. But it's important to cover your back, of course, if you're not medically qualified. So here, look at the whole report first. Focus on high and low results. If there's multiple high and low results, you're going to have to try and clinically reason where to intervene first. So again, it's really hard to tell you this is the exact way to do it, because I'm not sure there is. And I think you've got to take in each case as it comes, as we would do using functional medicine. But certainly, a lot of the time, if you like, my hidden like pearl would be I often start from the bottom of the report first, because it might be, for example, if we're seeing mitochondrial dysfunction and we have high dysbiosis markers, and then we have high markers on oxidative stress and toxins, for example, and then there's mitochondrial imbalances or errors in the metabolites. The way that I would think about that is, okay, possibly the microbiome is causing, or there's a cause of the increased oxidative stress, maybe due to things like hyperpermeability, lipopolysaccharides. I mean, could be the toxicants that's actually damaging the mitochondria. So I can't say that's always the way to look at this report. You of course have to go through the case history, the patient or client symptoms, the challenges they're having, and you need to, of course, make a decision on where to start. I think the one thing I would say is be careful not to fall too much into the trap of doing a this for that type approach. Why, especially allopathic, not that I've ever really worked in very classic allopathic medicine, but I've worked in a lot of hospital and medical screening. And of course, I think a lot of us are on this call because we didn't want this medication for that symptom type approach. But you can go into an organics and you can give this supplement for that result, and we're not necessarily doing a better job there. So you can find a lot of different imbalances on the test, and it doesn't mean you should give 10 different supplements. We really want to try and think about what's the underlying reasons as to why these markers are out of place. It may be that we do need to give multiple vitamin or mineral or support for that moment, but of course we want to get back to the question of why, and that's not always easy to answer. We don't always get that answer, but just don't fall too much into the trap of giving CoQ10 and B vitamins and herbs and a lot of different things at once. Try and look at where are the important areas to start and make it a reasonable intervention. So I don't always panic. We see a lot of highs and lows. I'm not going to panic too much about it. I'm going to focus on the area that I feel is most important to start with. or I might use more, if there's a lot of different areas, I might use more multivitamins, so then they're not taking a lot of different supplements, and go from there. So just want to, so this test that I've been putting up on the left hand side of the slide so far. So this is it's a 48-year-old male with fatigue, and the symptoms started around 2008, and they developed slowly, but over about a 9-year period, it ended up in him having burnout and depression and being signed off work. Now, he was in a really bad way, unable to work and drive, real total inability to focus. All red flag medical tests were performed at that time, around 2017, and the MRI, blood work, etc., nothing was found. Unfortunately, in 2018, he contracted Borrelia, but he was treated successfully. He has high cholesterol, borderline high blood pressure. I mean, it is technically high according to the new criteria. He's implementing a low carb diet, and his BMI is 26. So here we are, and this is quite a recent test that I'm showing here. So we're a few years on now from that situation. So if we just, let's see if I can, so when we, I can't get back here. Yes. So when we just go back over these results, as I'm going through this report, okay, there's no problems with the fatty acid metabolism. We've got a really high beta hydroxybutyrate. So the first thing is, when I know his cholesterol is elevated, he's informed me, and he's a bit over, BMI is 26. Didn't meet him in person, so it was hard to get a real view, but I had a sense that he was certainly overweight. So here, one of my concerns is there some kind of underlying diabetes that's not been tested for? So action point number one, I'm going to refer him, I'm going to ask him to go to his doctor, because he wasn't living in Stockholm. So it's harder for us to do the blood there. So go and get your blood sugar checked out. So that was one of the first action points here. Then, I mean, as I look down here, of course, everything else, it's quite nicely in the middle, or within the second, third, fourth quintiles. So nothing too much going on there, but a really high level of beta hydroxybutyrate. I've certainly seen higher, but that would be one of my concerns, that there's diabetes here. Then we've got in the B complex markers, see we've got quite a bit of certainly for markers 16 to 19, we've got quite a right-hand presentation, and the alpha ketoisocaprate is elevated. So this is certainly suggesting to me that there's a little bit of B vitamin insufficiency going on. So when I see like this, at least one marker out, a bit more of a right-hand presentation, I'm already thinking this, it's going to need at least probably a B complex or low B vitamins, especially. I mean, as we get into the methylmalonate and the minoglutamate, it's so difficult. I hate teaching about this test just to pronounce these names, but they're basically all normal. So we know folate and B12 is okay, but there's more problems in the lower B vitamins. Again, nothing too drastic. So yeah, it's okay, but there's some things going on there. Then the neurotransmitter metabolism markers, we've got high in kynurenate and low in picolinate. And we've got vanilmandelate and homovanillate. So often in burnout patients, fatigue patients, then we can often see these markers with a left type presentation, when they're especially gone way over through some kind of stressful period. They tend to be more down here. And then we've got this high or borderline high, like start of the 5th quintile, p-hydroxyphenyl lactate, which is right at the end. So it's definitely not, again, an ideal type situation. Right, so final one here, detox mark. So we've got a bit more of a right hand presentation here, but nothing too drastic, nothing I'm going to get too worked up about at this stage. I'm more interested in that beta hydroxybutyrate for now as the first risk factor, but here I'm thinking, okay, certainly wouldn't be a bad thing to assist detoxification. And then we've got of course the bacterial, yeast, fungal origin markers. Nothing too abnormal there. Again, we've got the hippurate, which is certainly in the 5th quintile, but no major issues. Now, sometimes what I do see is I run a lot of GI map testing, especially, and we do find that I have found in some patients that even with a GI map or CSAP, we might not actually find high yeast or candida markers, but then sometimes on the organics, we get a high arabinitol level. And I have one case study to share next with you where we did actually find that the stool test didn't show anything, but something came up on the organics, which was very interesting. So I do like, especially, I really do like this part of the organics report. I went through a stage of if I was doing a stool test, I would just cut this part off. I just wouldn't bother getting it. And that would save some money for the patient. But then I've actually found some patients where we've had a high marker here and not on the stool test, which have then done really well through treatment. So I would always say, if you can, keep this on. It's very, with the organics, it is nice that you can run the basics organics just by itself, and that means it just cuts off this last part of the report. So with the results from this patient, we've got high beta hydroxybutyrate, so possible diabetes. We need to check fasting insulin. We could do an oral glucose tolerance test. It could be a cytochrome oxidase defect. So of course, if all these results come back quite normal, then we know probably the likelihood is it's this issue going on here. Now, if this is, of course, diabetes or pre-diabetes, I mean, we have some different interventions. Of course, we've got Prolon, fasting mimicking diet, very effective at reversing that. We can use berberine. It has a very similar light action, similar to metformin. So it's a weak, like complex 1 inhibitor in the mitochondria. So sometimes we might use that. Of course, there are other supplements as well you could use if there's high beta hydroxybutyrate. We've got things like L-carnitine, CoQ10. So again, might use especially CoQ10, a bit supportive. If they have fatigue, does it help them or not? If it helps, then keep it in. If we use it for a month and it doesn't help their fatigue, then I normally might not continue that on. So then with the high alpha keto isocaprate, usually indicating thiamine deficiency, so we can use thiamine directly. We did see quite a bit of a right-hand presentation with the low B vitamins, so we might go for a B complex instead. Then high kynurenate, and that's often high in inflammatory disorders, or it can indicate there's some kind of cellular pathogens. We do know he's had Borrelia, but he was apparently treated successfully for that. But when kynurenate is high, again, it may prompt questions around, was the Borrelia treated appropriately, long enough? Is it definitely gone? Could this be reactivation of other pathogens or viral reactivation? Most commonly, it's B6 deficiency. So we, of course, can use some B6 to boost that and help that pathway. Then low picolinate, protein insufficiency, maldigestion, could be excess polyunsaturated fatty acid intake. So again, might need more of a dietary workup by one of the specialists in the team, dietitian or nutritional therapist, to see what is the case. Of course, don't have any stool test markers, so we don't know, is it maldigestion or protein insufficiency? Difficult to say. So there wouldn't necessarily be any direct interventions from that, because we still have questions around, well, why is it high? But of course, if he had a high amount of stress, then probably the digestive system has been affected in some way. So likely my guess would be slight maldigestion, maybe. The protein markers on the test. So let me just go back a bit. The main protein markers, we're going to see if there is protein deficiency. Often you'll see it here on 7, 8, and 9, citrates, isosonate, and isocitrates. So as I'm not seeing that on this test, I'm going to be less worried about protein insufficiency. More is it a bit of a maldigestion here, or it could well be the diet. So things to think about. And then, so I think if we take this test, these would have been, okay, from the results, that the main interventions I would have focused on. I want to know, is the diabetes? I'm definitely going to give thiamine, and I'm definitely going to give B6. They were the key results. Now, because there was borderline areas, we certainly could give a B complex, and there were some neurotransmitters, vanilmandelate, so all related to adrenaline, homovanillate, all related to dopamine, HPA axis dysfunction, chronic stress. So we could give some tyrosine deficiency. We could give some tyrosine because maybe there is some deficiency there that's leading to those lower levels. There is another marker of possible protein malabsorption. So we could try that clinically and see if it helps. If you notice it picks him up a little bit. We could use something like Arctic root. There's many others like ashwagandha, schisandra. There's other kind of adaptogens or more HPA axis support you could use. And of course, we could use vitamin C, liposomal, because we've got that kind of borderline hydroxyphenyl lactate, and that will help to move that down. While I understand what's actually going on, what's driving that oxidative stress, probably main suspicion right now, we've got kind of a bit of pre-diabetes going on, so likely driven by blood sugar. Okay, so that was how we typically work with that one case study, and then we've got a further case study here. So I'm going to go a bit back and forth in between a few different tests. So as we go down here, again, no issues with fatty acid metabolism, but we've got lactate and hydroxybutyrate. I mean, if we compare this 2.4, it's nothing compared to the previous test. But lactate are on the higher side of normal. Again, that's a common finding in fatigue and burnout type patients. And of course, a lot of these patients don't exercise regularly. Of course, they don't feel for it, and they can't do it. And of course, when you don't exercise regularly, you get unfit. You're going to produce higher lactate with minimal exertion. So again, sometimes we're just seeing lactate is a bit high because the client is unfit. We need to get them fitter. So that's something, of course, in the longer term we want to work towards. Now, as we go down here, citrate that are right, we've got isocitrate towards the left-hand side. So a bit of a mixed presentation here. And then B complex, all fairly normal. Methylmalonate approaching end of normal here. So something to keep an eye on. And then we've got the 5-HIAA. And this is well, it's considered a marker of serotonin. And then not too much else here, but a bit split left and right. And then nothing abnormal with oxidative damage. And then as we get here, we've got some high glucarate, and then we have high hippurate down here, but look at this, arabinitol, so very high at the bottom. So this is a female suffering from brain fog, fatigue, and debilitating migraines. We've got a bit of her history here. I'm not going to go through it all, but the key parts was that, migraine diagnosis, age 20, chronic migraines in periods, migraine most days. Again, history of burnout. So long history of migraines, big problem, low heart rate variability below 30. So one of the main things I started doing here was started to concern mostly with the yeast finding at this stage, because again, if we go back through, I mean, the yeast one and the 5-HIAA, which again, some will argue that that's more a product of the digestive bacteria, what we're seeing here, rather than the brain. So first thoughts were, okay, this seems to be something interesting here. So I started with treating the yeast, and I did a herbal protocol that used Paldarco tea and undesolenic acid, some oregano, and the interesting thing was that I, especially with the Paldarco tea, that would bring on her migraines. So that immediately got me very suspicious that, okay, these migraines are somehow they're fungal or mycotoxin related. And as you can see, when we did a follow-up test, we've got the high hippurate here, the high arabinitol. So even though we treated for quite a period of time, approximately, I think at least 6 months, it wasn't down to normal, and it was a problem because every time we were trying to treat this fungal issue, it was bringing on the migraines. So what we did is we switched to medication. We switched to nystatin, which is a drink, prescribed medication from one of the doctors here at the clinic. And we were able to drop that arabinitol down to 60, so much better. And also, basically, there was no migraine, as when we were using that treatment, there was certainly nowhere near the amount of, if you like, side effects, so to speak, from the migraine treatment. So also, as a comparison, while I was doing this, we ran an oat test at the same time. So the really interesting thing was when we had this final kind of Organix test, we ran this one at the same time, and the arabinose level was virtually identical. So this was, again, really nice finding to see. We've got the high hippurate marker, so I'm using this just to demonstrate that, again, these tests are so close, and it was in one way fantastic to see that they were giving very similar information. And you can see we've got a slightly high oxalate marker here. We've got some mitochondrial markers. So this test works slightly different, a bit different to read. Ideally, you want to be in the orange section, but technically you can be within the black line area. If it's abnormal, of course, you get this red triangle or diamond around it. We had some mitochondrial markers. So of course, at this time, I wasn't doing the full Organix test, but this one was showing some minor mitochondrial dysfunction. And we can see a lot of ketone and fatty acid oxidation here. So you need to definitely use carnitine and B2 to help to basically move the fats into the mitochondria more effectively. So that was a key area of focus. And then, yeah, some other minor things here. We've got, you know, the B5 marker a little bit on the high side. We've got this methylation or toxic exposure a little bit on the high side, and then all the amino acids are yeah, quite normal according to this test. So then again, after further treatment, now we're getting an arabinose that is getting much closer. All of these markers looking a lot healthier, but we have a slight increase in the aspergillus. So we know we're not quite done with the treatment yet. We've still got markers here which we need to act on. Here, after doing some, you know, various additional supports, as you can see, we're looking much better through the results. We've got slightly low acetonic acid going on here, and then the quinolinate was a bit low on this side as well, but it's getting a bit smoother. Again, we've still got problems here in the ketone and fatty acid oxidation, so we really need to keep pushing on with that. But also, she was doing quite a high ketogenic diet, so we know we need to help give more digestive support with that. And then vitamin C, bit low this time according to the test, and then everything else looking a bit more normal. You know, we were doing also a lot of support things like sauna therapy. We were utilizing really good food intake. So, but at this time, I mean, this patient, the migraines had disappeared, much more functioning. Brain fog was gone, could focus a lot more. So even though there are still results which are not perfect yet, I think you know, it's a really nice case study just to see the progression and the comparison of the different tests and how they are very similar. And it was really the main thing, even though we did a lot of additional support on the way, some glutathione at times, you know, some vitamin and mineral and antioxidant support, but the main thing there was definitely the fungal treatment. So yeah, so like I say, I mean, really don't always get too flustered if there's a lot of different results outside the ranges. I mean, you've got to look at these cases of course that they're going to need to make behavioral and lifestyle choices, do things differently. You're going to have to work on that over time. You're going to have to build it up step by step. You're not necessarily going to get an abnormal result and then a perfect result next time. So it's just about working the case through and trying to put the right pieces of the puzzle in the right place at the right time, which of course we don't get right all the time. We get it wrong. We have to try different things and be prepared to backtrack and use the tools we have available to try and get the result in the end. Okay, so I think the whirlwind is just about finished.
And some questions are coming up here now. It's a little bit confusing if it's an oat test or an organics test that some of the questions are on. But one asked if, and I guess this is in the oat test, how you use the amino acid markers in the test. So I guess in the oat test, there's some amino acid markers in urine, and in organics there isn't per se, but then there's like a pattern recognition that if some of the markers are low, this can indicate amino acid deficiency. Do you have a comment to that?
Yeah, I think it's so. I mean, with the amino acids are slightly easier to understand in the organics test than the oat test, so to speak, because yeah, they can be, or the markers can be very low in the oat and still be okay. So I think it's more in the oat test, as the way that I understand it, is that you're looking much more for those the high levels rather than the very low levels. So I don't know if that gives was that the question?
I don't know
Yeah.
But I would say that I mean, we always, like with the Organix test, I for sure always kind of read it backwards. So I cover the gut first, and I noticed that you did it as well, where we cover the gut first and then detox and then oxidative stress. And then we move into some of the neurotransmitters that are amino acid related. And then so is mitochondrial, or the Krebs cycle is also amino acid dependent. So i.e. if there's a lot of low markers there, it could indicate a possible amino acid deficiency. And the oat can be a little bit difficult to read because it does answer on some of the amino acids, but then it very often looks as if it's low, but it's still within the 95% reference range. So sometimes the oat test is just a little bit difficult to read. But I think, Graeme, you demonstrated it quite nicely, that you have the lines and it's a 95% reference range. That's normal. But once you're outside the lines, but it can look as if it's low or high, but you are actually within the 95% reference range.
Yeah.
If you want to know more about amino acids, you would have to do like an amino acid blood spot test, or you would have to look into a urinary amino acid test to really understand more. And then the question comes, is it a gut problem or dietary problem or metabolic problem in regards to the amino acids?
So I think just to clarify there, that I mean, in the oat test, you're only really looking from the amino acid metabolites. You're looking for increases only, and those increases in those amino acid metabolites, they that could be due to inborn error of like methionine metabolism, or it could be lactic acidosis or ketosis or deficiencies of certain vitamins. It could be from other genetic diseases. So I mean, it's more, I think, in the oat test, because it's got more amino acid metabolites, so you're looking for high markers. It's really, as I said at the start, you're using that more for inborn errors of metabolism. Whereas I think with the Organix, you're getting a bit more about mitochondrial function from lack of amino acids. So I don't know if I'm making any sense here, but it's slightly the different elements with the different tests, with the amino acid markers and how to read them and what it means.
Super. So quite a few questions have come. Should we stop supplements before we take the test, or should we not? My point on this is that if the patient comes to me for the first time and they're already on a supplement regime that they have been taking for a while, I just ask them to take the test, and then we see what that supplement, see what their situation is whilst they're on that, and if there's something I need to do better. I never ask my patients to stop on the supplements because I want to see how their test, what their test looks like when they're doing the program that I have suggested that they're doing. I mean, if someone has SNPs in some of the MTHFR, or so that they need extra folate, then giving them folate for 3 months and then taking them off it to see if they're still, if now that's fine, that's a little bit wrong, because we know that there's some genes that indicate that they may need continual intake of extra folate, or it could be the B12. So in a way, you don't necessarily want the patients to stop and only get baselines every time. You just want to see a continuum in the treatment, and if we can get them to what can you say, an optimal health situation. Do you agree with that?
Yeah, absolutely. I think you summed it up quite nicely. I mean, it depends what you want to see. Do you want to see them on the supplement or off? And that depends on the history and use of the supplement and where they are in their journey. So yeah, just depends on what you want.
What else? Oh yeah, this I don't know the answer to this. If a patient had a GI map with no indications of dysbiosis and the Organix shows a positive dysbiosis, could it be due to paradentose? I'm going to say it in Danish.
Periodontal disease. So,
there you go.
Periodontal, yeah.
You know that? Does anyone know that?
I think that's a really good question. I mean, the only way what I can say, the way that we've picked up periodontal disease is, if I'm saying that right, because now you've confused me with the Danish pronunciation. I think we've ran on some patients. We've done a shotgun method genomic sequencing of the blood, mainly in chronic fatigue, ME cases, and there we found that more than one case. I think we had 2 cases where we found oral bacteria present in the blood, so oral cavity bacteria that should not translocate into the blood, and that has given us the clinical indication that something is not correct. So then we've referred to a specialist dentist, and in both occasions there's been silent teeth or a tooth infection that then has been removed, and the symptoms have significantly improved patients. But I think we do see, whether or not it's due to oral situation, I don't know if you could pick that up on an Organix, because if you had some kind of oral infection in the mouth, would that then produce the metabolites in those levels that you would see in the urine? I don't think.
Because if you look at some of the metabolites, it's phenylalanine that some of the bacteria are munching on, and then you get a phenyl something, that's the metabolite. So it indicates that some form of fermentation must be going on in order for the metabolites to. So I don't think it's. I mean, then the bacteria from the mouth should translocate in and then ferment some of the amino acids and polyphenols and so on, so that we could measure it in the urine. I think we are out on something that we can't quite.
I think definitely. I think candida, but again, would you? So of course, the mouth can be a reservoir for candida, and then especially if there's poor oral hygiene, you can get that moving into the gut. And then if you're running a GI map, again, it may be that because it only measures certain species, you're not getting everything. And we have had, like I said, we've had both CSAP and GI map cases where there's not been anything abnormal, but we've had a very high arabinose that then has been treated, and we've had improvement in symptoms. I think certainly oral cavity health should be considered in the workup, regardless. I mean, that's always good questions to ask, and this, especially this last case study I've shown. I mean, I was consistently asking her, I mean, I want you to double check your oral cavity, make sure you go to the hygienist regularly, because I was concerned that the reason why we're having such a hard time getting rid of it over a long period of time was that there was some other underlying issue in the oral cavity that we couldn't see any symptoms for, but was maybe happening. But after a while we stopped looking at that, because as soon as we got on, especially the nystatin medication, things started to move a lot faster. I think it was just a really chronic infection that had been there for a very long time and just required longer treatment.
Super. So that answers kind of some of the questions that came up in the end. Yeah, one asked if you could just highlight the ketone thing again. So if ketones are high, but the person is not on a ketogenic diet, so that's where you indicated like that you were concerned about like insulin resistance and basically not the cells not getting enough glucose or sugar.
Yeah, exactly. So now it could also be so if beta hydroxybutyrate is very high. I mean, of course, naturally you think low carb diet or fasting, but then you can think about possible diabetes or impaired like glucose metabolism. But there also can be like defects in this cytochrome oxidase enzymes, and that will affect the electron transport chain. So there could be some kind of inborn error of metabolism. So, but certainly I want to rule out the diabetes aspect. And then if there's no low carb diet, there's no fasting, there's no diabetes type issue, then it's probably leaving you with that there's some kind of error, inborn error of metabolism. And we do see patients that have high markers there with no explanation, and they don't necessarily have any overt symptoms related to that.
Super. So last question, I think, if the test shows indication of mold or candida, what would you suggest? And I would move on to the mold toxicity test and check if there's any exposure to any molds for sure. And then of course, if you can maybe do stool tests for candida, or just start treating basically based on the Organix test. Do you agree?
Yeah, absolutely. I mean, I think the mold aspect is a rabbit hole that you might need to be prepared to dive down, because then if you're going on to like a mycotox profile, or I mean, probably then people are going to have to investigate homes, and do they need to move home, and do they need to like tear walls down, and has there been water damage, and where is it? So I think usually we're going to try and do everything we can, unless there's a very clear indication that there's been water damage or there has been mold, and there's other people that have been affected by it. So again, a great question is, if you've had mold at home, there are other people in the family affected by it, yes or no? Yes, then yeah, definitely go down there. No, I mean, of course, it could be genetics, which means that one person doesn't deal with that mold as the others do. But I think mold is always that's a long journey potentially of trying to find out what's going on. So usually I would do candida first and address the aspects that I know are more in my control and the patient's control to address and work with, before we necessarily start going down the mold route. Of course, unless there's very clear evidence of mold symptoms and problems, and then of course we'll go straight to that.
Super. I think the answers or questions unanswered have been matched. And so thank you everybody for staying tuned for this Organix presentation. And remember, next time is the 20th of May, and it's on the other stool test, GI360, and what was the other one?
GIFX.
GIFX, yeah, exactly. So, and we will send out the recording to you as soon as possible with extra notes and slides and everything we can. So everyone, thank you very much. Graeme, thank you very much for a sterling presentation as usual.
I can't believe I'm trying to do GI360 and GIFX in one session next time. That was a stupid idea. Clearly, I've not thought that through.
Well, I'm sure you will do just as good a job as you did today, where you actually matched both oat and organic. So we are looking forward to it. Take care.
Thanks. Bye.